The victorious Khmer Rouge communists prohibited Western medicines as part of the fanatical effort to purge Cambodia of all Western influences. Their brutal 4-year regime was characterized by mass executions of the educated, inhuman labor, and rampant starvation and disease. This nightmare of 4 years left over 1/3 of Cambodia's population dead. In mid-1979, Vietnamese troops seized control of a weak and crippled Cambodia. In the chaos of this invasion, Cambodia's tightly sealed borders opened, and close to 500,000 Khmer fled to the refuge of Thailand's western border. Starving and near dead from exhaustion, the deeply traumatized Khmer settled in temporary encampments along the Thai-Cambodian border. International medical teams joined efforts to meet the desperate needs of the refugees. This was, for many Khmer, their first exposure to Western medical care.
Our team was the team that had first contact with the patients throughout the changing in Cambodian. And the first contact in the beginning meant the large numbers of people flowing across the border. And then later on first contact was really the referral from the outpatient clinics for those patients who are likely to need hospitalization. Well, I think people were perhaps more willing to accept Western medicine than they might have been, but fear of both the disease and everything that had gone around them made them ready to seek help wherever they could get it. It is important to notice, however, they did recognize the value of their Khmer, Kru Khmer medicine as well, and often relied on that. So it wasn't a matter of accepting one in rejection of the other.
Once the most urgent medical needs were met, the effects of prolonged trauma became evident in the refugees. Large numbers of patients were diagnosed as psychotic or schizophrenic. The International Committee of the Red Cross sought to respond to this high incidence of mental disorder in a manner compatible with the ethnological background of the Khmer. Traditional medical centers, staffed by the indigenous Kru Khmer, were established in the refugee camps. These healers had considerable success with mental disorders which could not be addressed through traditional Western means. With special diets, herbs, meditation, massage, and supernatural intervention, many difficult cases were cured.
We did have mixed seminars between the medical practitioners there in the camp and ourselves for a number of reasons. One is we wanted to make them perfectly aware of what we considered emergencies in Western medical ideas, such as high fever and headache and spots that might indicate meningitis. And they then told us what they thought as the main role they could play in health care for the Cambodians. The care of psychiatric problems, both in Western medicine and in Cambodia, is totally dependent on communication. And then the spectrum in between is where we were trying to recognize when we would move a patient rapidly to the Kru Khmer for medical care, and when they would move a patient rapidly toward the Western style medical care for that kind of care.
In late 1979, Western governments offered permanent resettlement to a limited number of Khmer as political refugees. After several years in temporary camps, with meager food rations and inadequate sanitary conditions, the refugees arrived in the West in poor physical and emotional health. The transition from the rice paddies of Southeast Asia to some of the most difficult urban environments in the West was staggering for even the most westernized Khmer. Many obstacles barred the way of their physical and psychological recovery.
When they don't understand well, when you do the birth draw, that they believe The blood is very important for life, so if you take the blood, that means you almost take a part of the children's life, so they feel like upset or depressed with that.
The Khmer expect both traditional and Western healthcare practitioners to diagnose and treat an illness immediately. If additional tests are needed, or medicine is not prescribed, the Khmer patient may doubt a doctor's skills and seek help elsewhere.
When they go to see the doctor, they expect something from the doctor, especially the medicine, just to talk with the client and have blood tests, because a lot of people go to see doctor, have blood tests, and send the client back home, and they got very angry.
They want medication. Why the doctor don't give me medication and draw my blood? And because I came here, I am sick, and I left the center without medication. I don't want to come here anymore.
When they come to you, like with 40 degrees or 41 degrees centigrade high, they want a child cured in the next day, or at least having the fever going down. If you don't satisfy, they go to another doctor.
The Khmer closely link symptoms to disease. If there is no pain and no visible symptom, there is no sickness. This view creates continual difficulties for preventative health care and successful medical treatment of the Khmer. Many continue to rely on home treatments and Asian medicines available in the West.
Most of the herbal medicine that they use, they don't talk to us about, and I think that they get a lot more reinforcement for using when they go to the Chinatown Health Clinic. And I think there's a lot of that. I think that because of perhaps the cultural similarities, a lot of our patients will use both systems. We'll go to Chinatown and use more herbal kinds of medicines that they have to offer, and then we'll also come up here. And I think the order in which they come depends on which works.
The doctor cannot tell this is wrong, this is right. Recommendation just to encourage patient the way the patient think what to do best. If the doctor tell this is bad way, this is the good way, I think the patient couldn't come anymore.
I think one of the mistakes that we made in the very beginning was not to take into consideration those cultural differences, and I think we're still learning them a lot. I think that initially we would see children who came in who had been coined and had bruises on their chest walls and who had purple circles on their foreheads, and you're like, what is going on here? Or you'd see children with scars on their abdomens, and when you work in New York City and you see that, and you think somebody's burning this kid with a cigarette.
Some doctors understand about our culture. They will not ask why you use coin rubber, because if you ask too many questions to the client, and he will get very upset. Why don't I use my belief?
I think there's no question that you have to respect these traditions. I mean, I think that many of these traditions are age-old and lifelong and part of what people bring with them to this country. I mean, I think that one basic reason to respect them is that it's important that people who come to this country not have all their cultural remnants be taken away from them. Clearly, some of the things that they've been doing for years and years are valuable. I think there are things that they've been doing for years and years that aren't valuable, and I think it's important that we teach families about that. I think it's important that we educate them that if they're doing things that are harmful to their children, that they don't do those things.